Now we discuss a new topic that is oral aspects of metabolic disease. So basically these are metabolic diseases and the after effects which are seen in oral cavity are discussed here. So the first question is, delayed eruption of at least part of the dentition is a recognized feature of all of the following. So delayed eruption is there. So these are manifested in which diseases? That is a question. So first one is rickets, cleidocranial dysplasia, and cherubism. These three are seen in delayed eruption. That means delayed eruption is seen in these three diseases. Okay, rickets, cleidocranial dysplasia, and cherubism. Next question. A 5-year-old child presents with chronic bedwetting and bilateral loss of deciduous first molar. His mother says that he wants to drink water several times during each night. Which of the following is the most likely diagnosis? The answer is Hand-Schüller-Christian disease. Next is, which of the following is related to the enzyme deficiency and involves periodontal destruction around the primary teeth? The answer is hypophosphatasia. Okay, the osteomalacia is normal osteoid plus defective mineralization. That is osteomalacia. Normal osteoids will be there, but the mineralization will be defective. The deficiency of which of the following vitamins does not affect on tooth development? Vitamin K. Vitamin K deficiency does not affect tooth development. Then which of the following tooth structure during the formation is most affected due to vitamin A deficiency? Enamel is mostly affected. Then Addison's disease is related to adrenal cortex. Which of the following is least affected in vitamin C deficiency? Least affected is a question. Answer is epithelial lining of the mucosa. Next, Dinesh, a 24-year-old male, complains of loose teeth in a single quadrant. His radiograph shows irregular bone loss and histopathology reveals eosinophils and histiocytes. The most probable diagnosis is Hand-Schüller-Christian disease. Next, a progressive increase in mandibular length and in mandibular interdental spacing in an adult patient is a characteristic of hyperpituitarism. So, growth is affected, so hyperpituitarism. Okay, increase in length. Then which of the following deficiencies are associated with the disorders of hyperplasia of the salivary gland and keratinization of the salivary gland? Deficiencies affected in the keratinization as well as hyperplasia of the salivary gland. There is a question. It is vitamin A deficiency. Next, oral lesions on the tongue and other mucosal surfaces of the oral cavity is caused by the deficiency of. Oral lesions will be there. It will be on the tongue and other mucosal surfaces. The answer is niacin. Okay, niacin means vitamin B3. Okay. Next, deficiency of which of the following will cause enamel hypoplasia? Deficiency of which of the following will cause enamel hypoplasia? The deficiencies of A, C, D causes enamel hypoplasia. Okay, vitamin A, C, D causes enamel hypoplasia. Next, which of the following may be a feature of acromegaly? Acromegaly, a large tongue. Okay, then gingiva is most commonly affected by the deficiency of vitamin C. Magenta tongue and cracks at the corner of the mouth are seen in the deficiency of riboflavin. Okay, magenta tongue and cracks at the corner of the mouth. Okay, it is due to riboflavin deficiency. Diabetes insipidus, bone lesions, and exophthalmos is seen in Hand-Schüller-Christian disease. Diabetes insipidus, bone lesions, and exophthalmos is seen in Hand-Schüller-Christian disease. The histiocytosis X is a spectrum of disorders which include the following condition. Histiocytosis X is a spectrum of disorders that includes eosinophilic granuloma, Hand-Schüller-Christian disease, and Lederer-Seaway disease. Okay, three options: eosinophilic granuloma, Hand-Schüller-Christian diseases, and Lederer-Seaway disease. These are included in histiocytosis X spectrum of disorders. Okay. Next, an etiological factor for macroglossia is Hurler syndrome, a disease which only affects the formation and eruption of the tooth but does not cause hypoplasia is hyperthyroidism. Always remember one special question. A disease which only affects the formation and eruption of the tooth but does not cause hypoplasia. That is hyperthyroidism. Next, premature exfoliation of the deciduous teeth is seen in hypophosphatasia. Bone changes in hyperparathyroidism include, okay, bone changes in hyperparathyroidism include generalized demineralization, brown tumors, and cystic changes. So, bone changes in hyperparathyroidism include generalized demineralization, and brown tumors and cystic changes. Next, eosinophilic granuloma results from the proliferation of histiocytes. Eosinophilic granuloma that results from the proliferation of histiocytes. Next, acrodermatitis enteropathica is due to the deficiency of zinc. Acrodermatitis enteropathica is due to the deficiency of zinc. Vitamin D deficiency disease. Vitamin D deficiency causes all which are caused due to vitamin D deficiency. The answer is widening of the predentin will be caused by the vitamin D deficiency. Then interglobular dentin formation will result and defective calcification. These three will be caused due to vitamin D deficiency. Next, an abnormal resorption pattern in the primary teeth, delayed eruption of the permanent teeth, and large tongue are the features of hypothyroidism. Okay, abnormal resorption pattern in the primary teeth, delayed eruption of the permanent teeth, and large tongue. These are seen in hypothyroidism. Next is lamina dura is lost or partially lost in hyperparathyroidism. Which of the following is associated with a low concentration of the ionized calcium in the serum? Low concentration of ionized calcium in the serum, tetany. A 50-year-old obese man complains of several recent abscesses in the gingiva with the loosening of the teeth. He also suffers from itching of the skin and polyuria. The most probable etiology is diabetes mellitus. Consider the following statements. Giant cells are characteristic histopathologic finding in giant cells are seen in brown tumor of hyperparathyroidism. Okay. Next, bone pain, bone cyst, fractures and renal stones are characteristic of hyperparathyroidism.